Hello and welcome to Medical Dialogues. I'm Dr. Ganmasoni. Here's what I bring to you all from the world of medicine. Research finds consuming fruit and oats increases type 1 diabetes risk, but berries offer protection. New research presented at annual meeting of the European Association for the Study of Diabetes in Madrid, Spain, has found that eating fruits, oats, and rye in childhood is associated with a higher risk of developing type 1 diabetes. Eating berries, however, is linked to lower odds of developing the condition. Type 1 diabetes is an autoimmune condition in which the immune system attacks and destroys the insulin-producing islet cells in the pancreas. This prevents the body from producing enough of the hormone insulin to properly regulate blood sugar levels. Type 1 diabetes, the most common form of diabetes in children, is increasing worldwide. The number of cases worldwide is projected to double in just 20 years, from 8.4 million in 2021 to 17.4 million by 2040. The type 1 diabetes is a serious condition that requires lifelong treatment and so places a considerable burden on the patient and their families, says Professor Suvi Virtanen of the Finnish Institute of Health and Welfare, Helsinki, Finland, who led the research. It can lead to complications including eye, heart, nerve, and kidney problems and shorten life expectancy and has substantial healthcare costs. The rapid increase in type 1 diabetes in children suggests that environmental factors plays an important role in development of the disease. Identifying these factors will offer an opportunity to develop strategies to prevent it and its complications. Numerous foodstuffs have been linked to islet autoimmunity, the attack on the insulin-producing cells, and type 1 diabetes, but there is a lack of high-quality evidence from prospective studies and the existence of a link remains controversial. To address this, Professor Virtanen and colleagues explored whether diet in infancy and early childhood was associated with the development of type 1 diabetes in thousands of children in Finland. 5,674 children with genetic susceptibility to type 1 diabetes were followed from birth to the age of 6. Food records completed by their parents repeatedly from the age of 3 months to 6 years provided information on the entire diet. By the age of 6, 94 of the children had developed type 1 diabetes, another 206 developed islet autoimmunity, and so were at substantially increased risk of developing type 1 diabetes in the next few years. The 34 food groups covered the entire diet, and when they were all factored in, several foods were associated with a higher risk of developing type 1 diabetes. The results show that the more fruits, oats, and rye children ate, the more their risk of type 1 diabetes increased. In contrast, eating strawberries, blueberries, lignoberries, raspberries, blackcurrants, and other berries appear to provide protection against type 1 diabetes. The more berries a child ate, the less likely they were to develop type 1 diabetes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.